Hello, good evening, everybody. Welcome to our Tech Tuesday. And as we dive a little bit deeper into the technical side of nutrition and how it works in these amazing little systems that we call our body. And obviously, everybody is different and everybody is unique. So what works for you might not work for me and vice versa, which makes life particularly challenging. And we've been learning how certain foods interact with certain medications and what combinations they are, and how it should work and how it shouldn't work. So essentially, be careful about what you're taking when it comes to medicine, and watch what you're eating when it comes to medicine. Obviously, we don't want to have too many medications, but there are interactions and we just need to be aware of it. My suggestion is speak to your pharmacist. Do not question your doctor too closely because he's probably not going to be able to tell you the difference. So rather speak to the pharmacist, not Dr. Google either, but speak to somebody who knows what those interactions are. And if they don't give you a satisfactory answer, ask them to research it or find somebody who can give you a satisfactory answer. That's just my personal tip. So let me share my screen. Tonight we're going to cover next bit, which is the certain dangerous interactions that we need to be aware of. It's just like that. And from the beginning, let me slide this down. There we go. All right. So we've been talking about food and drug interactions and what to be aware of when taking medications or going for surgery. You know, I work in a hospital field or hospital setting, and I work in the medical field, and we sort of kind of talk about it blithely and take it for granted that, oh yeah, you're going to go in for a surgical procedure, you'll be in theater for a little while, you'll come out, you'll recover, and if it's a simple procedure, for day surgery, you'll go home the same day. If it's something bigger, you'll go home in about 3 days, if all goes well and according to plan. However, it's not always that simple. As I often say to patients, I ask them the question, what is the definition of minor surgery? And if you don't know the answer, it's any surgery somebody else is having is minor surgery, not the surgery you're having. Yours is major. So be careful, be aware. And tonight we're talking about 5 dangerous food and drug interactions. And this was taken from a Pharmacy Times article that I found. Some of those interactions that we need to be aware of is calcium and antibiotics and osteoporosis medication, green vegetables and anticoagulants, bitter oranges for benzodiazepines. My apologies for the pronunciation because I'm not that good with drugs. Calcium chain blockers and statins. Alcohol, well, alcohol is just bad in all different ways, but specifically interacting with antibiotics, antidepressants, paracetamol, and insulin. So for diabetics, stay away from alcohol. Tyramine foods are things like antidepressants you need to be careful of, and any foods you need to be careful of, bisphosphonates, hyperthyroid drugs, and digoxin, which is a heart medication. But the ones we're going to focus on tonight are the foods that we eat that can interfere with the medications we take. Patients may not recognize that otherwise healthy foods can have severe consequences when mixed with certain drugs. Have you ever heard somebody say, I'm fine, I eat healthy, but I do take, I'm on cholesterol medication, I'm on blood pressure medication, I'm on heart medication, but yeah, I'm not on anything major, just these basic medications, but I eat healthy and I try and be healthy. Well, maybe not always that good. As medication experts, pharmacists should recognize their responsibility to clearly communicate the risk of possible food-drug interactions for both prescription and OTC or over-the-counter medicines. And some of the most dangerous food-drug interactions that pharmacists can help to prevent include things like calcium, as we said, calcium-rich foods and antibiotics. Now, what are foods that are rich in calcium? Obviously, we know about milk, but then there is yogurt and cheese and cottage cheese and tofu and sardines, soybeans, almonds. All of those are high in calcium. Dairy products such as milk, yogurt, and cheese can interfere with certain medications, including antibiotics such as tetracycline, doxycycline, and ciprofloxacin. These are some big words, but you'll find them on medication leaflets. And these antibiotics may bind to the calcium in milk, forming an insoluble substance in the stomach and upper small intestine that the body is unable to absorb. So in other words, you're happily taking your antibiotics, and maybe you've had it with a milkshake or a bit of yogurt to try and dull the taste to a certain extent. Yet all you're doing is getting this gobbed up in this big blob in your stomach, which the body can't actually use. So what happens when the body can't use something? It gets rid of it. Pickled, cured, and fermented foods. This food category contains tyramine, which has been associated with a dangerous increase in blood pressure among patients taking monoamine oxidase inhibitors, or MAIOs. Please don't ask me what those are because I'm not that clued up on them. But your pharmacist will know. And if it's been prescribed, they will understand this terminology. Please speak to them. And the tyramine also reacts with certain medications for Parkinson's disease. With Parkinson's, there will be a whole lot of different things that are prescribed, so one needs to be very careful. The other thing is your vitamin K-rich foods and warfarin. Warfarin is a blood thinner. Vitamin K is a coagulant or something that causes clotting. So if, for instance, you're coming to casualty and somebody swallowed a pack of rat poison for whatever reason, sadly, kids do get hold of these things. Babies get hold of these things quite often. And obviously, rat poison is full of warfarin. Read the label, you'll understand what I mean. So the treatment, therefore, is they inject them with vitamin K to help to increase the clotting and therefore prevent any major problems. Pharmacists should counsel patients taking warfarin to maintain a consistent intake of vitamin K and avoid introducing kale, spinach, and other leafy greens to their diets. So if that's something that you already are eating, don't change the amount that you're eating. Whatever's happening, keep it like that, because they're going to be doing tests to check it. Vitamin K is vital for the production of clotting factors that help prevent bleeding, but anticoagulants like warfarin exert their effect by inhibiting vitamin K. In other words, the two cancel each other out. Therefore, an increased intake of the nutrient can antagonize the anticoagulant effect and prevent the drug from working. So if you're eating a lot of leafy green salads at the same time as you're taking warfarin, you are busy cancelling out the two, and you need to be checked because you're wasting your time and your money. Alcohol and prescription stimulants. Often these are combined to get yourself on a high, but not a good combination. Patients should always be wary of mixing any medication with alcohol, but some interactions are more serious than others. And most medication boxes, bottles, and inserts will tell you not to be taken with alcohol. For instance, ingesting alcohol while taking a prescription stimulant could cause the patient to not fully realize how intoxicated they are. So in other words, they become significantly more drunk than what they would be if it was just the alcohol. This is especially true when the stimulant he's being abused. But it can also happen when the patient takes the drug as prescribed and they go on a trip of note. We spoke about this in earlier presentations, which is the grapefruit and grapefruit juice and statins. Patients should avoid eating grapefruit or drinking the juice while taking some medications, in particular statins. And statins are what are usually prescribed for cholesterol. Compounds in the grapefruit called furanocoumarin chemicals cause an increase in medication potency by interacting with enzymes in the small intestine and the liver. This interaction partially inactivates a number of medications under normal circumstances. So then we're going to talk about the nutrition in the surgery guidelines. And this also came from a medical journal. So the outcomes of a surgery are directly related to nutrition status prior to and after surgery. And I've seen over the years that the fitter and healthier a person is before surgery, the better the outcome. It is very important to eat a well-balanced diet prior to surgery, including your fruits, vegetables, whole grains, and an adequate amount of protein. Does this sound at all familiar? Thinking breakfast pack? Vitamins, minerals, and protein are vital to the healing process. A single nutrient deficiency can impair the immune system, causing significant delays in the healing process and a decrease in the ability for the body to fight an infection. Anytime that the skin is punctured, your body is open to infection. And I've seen it in orthopedic cases. There was a case that stands out for me. The patient had had a knee replacement. They'd been riding a motorbike and scraped their foot on the footrest. And there was some metal over there, and he just had a scratch on his foot. It wasn't long before the infection had crept through that little penetration, or through that hole in the skin, went into the system and went into the bone straight to the prosthesis. The result was they needed to take the prosthesis out, clean up the infection, and then a few weeks later, put another prosthesis back again. And these cases are often an issue as far as infections are concerned. So be aware, be careful. So it's so important to have your immune system strong beforehand. Follow these guidelines beginning at least 3 weeks prior to surgery, or as long as possible prior to surgery, to optimize your nutrition for a faster recovery. Start by eating 3 to 5 servings of fruits and veggies every day. Choose a wide variety of colors. 1 serving of fruit is 1 piece of fruit, such as a medium orange or apple, or half a cup of canned or frozen fruit. 1 serving of vegetables is half a cup cooked or 1 cup raw. Fruits and veggies are excellent sources of B vitamins, as well as antioxidants, such as vitamins A, C, and E. Vitamins in fruits and vegetables support the body's immune system before, during, and after surgery. Think of carotenoid complex. Frozen vegetables and fruits are good to have available when shopping frequently. Okay, let me rephrase that. It's good to have these available when shopping frequently is not possible, or you don't have access to the delivery systems that we do these days. You need to eat 6 to 11 servings of whole grain foods every day. 1 serving is considered 1 slice of 100% whole wheat bread, a half cup of cooked brown rice, a half cup of whole wheat pasta, or a half cup of whole grain cereal. These are not always that easy to come by, and are not always 100% whole grain either. It has to do with labeling laws. Whole grains also contain B vitamins, which are essential to building the immune system and aids the healing process. If it's not possible to get sufficient whole grains in your diet, especially if you have grain or grass allergies, I would suggest taking a supplement such as Treonine, which, as we know, is whole grain oils. To the best of my knowledge, Treonine is the only true whole grain supplement on the market at present. You need to eat a variety of protein-containing foods at meals and snacks. Protein contains the essential amino acids that are vital to the healing process. The body's protein status prior to surgery also influences the recovery time. Good sources of protein include meat, fish, eggs, cheese, beans, nuts, tofu, and dairy products. If obtaining sufficient protein from the diet alone is not possible, consider using a protein drink supplement. But be very careful with those and make sure they're not high in sugar, and that the protein drink has all 22 amino acids, which makes it a complete protein. Be careful to read the ingredient label first, as not all protein drinks are the same, and some contain high levels of sugar. Complete protein drink should also contain all 22 amino acids. We need to use fats, oils, and sweets sparingly. So you choose healthier fats, such as canola. Speak to a dietitian regarding the healthy oils, and olive oil. Avoid fried foods, so stay away from the junk foods. Excess fat and sugar contain empty calories that do not provide the body with any nutrients. So you might feel full, but you're not getting any nutrition. And this is the part that frustrates the life out of me, because I'll often see, and sadly enough, quite often with children after they've had fairly big orthopedic surgery for various reasons, the first thing that the child is given when they come out of theatre, and they're back in the room, is a bucket full of chicken, fried chicken. This is not good. And next to the fried chicken is the chips and the Coke. Not a good thing for a body that is needing as much nutrition as possible. Too many empty calories and not enough nutritious food may have an effect on the immune system. You need to drink plenty of water in the 3 weeks prior to surgery. Staying well hydrated will help in the recovery process. It will also help during the period of time right before surgery that water is not allowed. You need to stay well hydrated. And if you're going for surgery, they will tell you, apologies, that you may not eat or drink anything from midnight the night before your surgery. And I can tell you from experience that surgery doesn't always happen at 7:30 in the morning. So you're starving from midnight, but you might not go into theatre at 7:30. In some cases, you only go into theatre at 4:30 that afternoon. You've been starving since midnight. Not a fun thing. General goal for daily water consumption is 8 to 10 8-ounce, or around about 236 ml glasses per day. Staying well hydrated also assists in keeping the blood flowing well, and therefore reducing the risk of developing unwanted blood clots after surgery. And again, this is something that keeps me in business, quite literally, because whenever we do big surgeries, like orthopedic surgeries, joint replacements, that kind of thing, Caesars, hysterectomies, all those kind of big abdominal surgeries, even having an appendix removed, my doctors regularly request compression stockings as one of the ways to reduce clots, because they know that statistically speaking, the risk is quite high, more so when certain other factors are involved, such as being overweight, being diabetic, being hypertensive, having a family history of clots, or yourself having had a history of clots before, the risk is very high. And as I said, you are being dehydrated from midnight the night before the surgery. So the better hydrated you are, the better your results. You need to establish consistent eating habits. So you need to eat a good breakfast every day, including a good source of protein like eggs, peanut butter, or Greek-style yogurt. Lunch should include a protein source, whole grains, vegetables, and fruits. Apologies. The evening meal should be similar to lunch. And remember to include healthy snacks, fruit, trail mix, hummus, and carrot sticks, or whole grain crackers with cheese or peanut butter. And I will add things like biltong or dry wors is probably also a pretty good snack to have. Go grocery shopping the week before surgery. If you're not able to go to the grocery store yourself, send someone with a list to shop for you. Or if you're fortunate enough to be in an area where delivery happens, to place an order online and have your food delivered to your house. Shopping for healthy foods right before surgery will allow you to keep up your healthy eating plan after surgery and during the recovery period. Focus more on shelf-stable items and buy fewer perishable items, especially today with all the power outages that we have. Shelf-stable items such as peanut butter, canned fruits in its own juice, and low-sodium canned soups are good to have available when you return home from the hospital. And hey, if you have that facility, do yourself a favor, make up a big pot of homemade soup and freeze it, that you can then thaw it and just heat it up on the stove when you need it. That probably would be even better than your canned soups because it's obviously a lot more nutritious for you. Get some exercise. Obviously, this is not always practical when it comes to surgery. However, if you can, walking is not only good for the body, it's also good for the brain. Exercise may help in clearing your head when you begin to get anxious. Most people that I see who are going into surgery are quite stressed. Even those that tell you, no, I'm fine, I'm not stressed at all. Most people get stressed before going into theatre. It'll also help you to maintain lean body mass or muscle. Muscle loss may occur after surgery due to physical inactivity. This especially if you're having big orthopedic surgery like joint replacements or spinal surgeries especially, you don't get out of bed for 2 to 3 days. Quite often people who have had major heart surgery as well, you don't get out of bed for a couple of days. And even if you happen to land up on a ventilator, you don't get out of bed for quite some time. And you'll be surprised how quickly you lose that condition when you're not using it. It is important to try to get back to doing some exercise as soon as possible after recovery. And most people will be given or see a physiotherapist directly after their surgery, and their aim is to get you moving as soon as possible. Listen to them, follow their instructions. Your surgeon can advise you as to when it is safe for you to resume or begin exercising. Obviously, some cases you can't get up and run straight away, but every little bit of movement makes a big difference. Depending on the type of surgery you've had, in most cases, a registered physiotherapist will work with you directly post-surgery and guide you on the correct type and frequency of exercise for complete rehabilitation. Tell your doctor about any vitamins, minerals, herbs, or other over-the-counter products and medications you take. They want to know these things. Some of these may be harmful during surgery, and it is best to stop taking them prior to surgery. And these include things like omega-3. Examples of herbal supplements to discontinue as soon as your surgery is scheduled are echinacea, ephedra, garlic, ginger, ginkgo biloba, ginseng, kava, licorice, saw palmetto, St. John's wort, and valerian root. Other examples include omega-3, which has a mild anticoagulant function, as do some of these herbs that I've just mentioned. And this should be stopped at least 3 days prior to surgery and resumed only after anticoagulation medication is finished. You need to speak to a registered dietitian if you have lost weight or having eating problems that are keeping you from eating healthy. And dependent on the surgery, quite often one will come to your bed as well. A registered dietitian will assess you and, oops, running out of time over here, and make recommendations for you to optimize your nutrition prior to surgery. Sometimes the recommendation of a liquid nutrition supplement may be beneficial. Depending on the type of surgery you have had, in most cases, a dietitian will consult with you in hospital directly post-surgery. That is the end of that. So if you have had surgery or are planning on having surgery, be aware, make a list of your generalized diet and more specifically your supplements. Don't always tell your doctor that you're taking vitamins. Just mention the types of foods like whole grains, etc., that you're using, because doctors will generally have a little hissy fit if you tell them you're taking a vitamin supplement, mostly because they don't understand them. So there's a lot of things that can interact and can cause a problem with your recovery, and more specifically with the medications that you're given both pre and post surgery. And remember, anesthetic is one of those things where things can be interfered with, and you don't want anesthetic to be interfered with. Trust me. So I hope that clarifies things for people. Does anybody have any comments or questions before I stop recording?